Wrist flexion and extension should be performed with the elbow flexed and extended. If limitations are observed in wrist flexion and extension with the elbow extended, this suggests that common wrist flexors and extensors are limiting the motion. In the following pictures of the following client, the elbows remain extended, and wrist flexion and extension shows wonderful range of motion. A grip strength assessment may also be an appropriate evaluation to utilize, as individuals with this condition are normally unable to squeeze maximally through the arm, as it causes range of motion limitation and occasionally pain with the contraction. Assessing the difference in strength, as well as pain before and after the continuum, will give us a good idea if our program is working for our client effectively. The following description shows our client's current strength through the arm. The following SMR description and demonstration will be utilized throughout the preceding 3 corrective exercise continuums. Myofascial release is essential to target inflammation and trauma of affected tissue to reduce muscle tension that causes muscle spasms. SMR can be used for 2 primary reasons. First, it can be used to alleviate the side effects of active or latent trigger points. Secondly, it is used to influence the autonomic nervous system. For our myofascial release video, we are using a set count of 1 with a duration of 60 seconds. The frequency of myofascial release is daily.
Alright, so today we are going to be doing a CES continuum for the golfer's elbow, which is also known as medial epicondylitis. So, the first thing that we're going to be doing is we're going to be doing some SMR to the extensor muscles. With this injury, it can affect the extensors or the flexors, but for the purpose of this video, we're going to be working with the extensors. So the first thing we're going to do is we're going to trigger point the extensor muscles. So we're just going to hold it in the belly of the muscle here. How does that feel?
Feels good.
So for 30 to 90 seconds, we're going to hold this here. So with this, since it affects all the extensor muscles, we're going to be wanting to move, make sure we're moving the ball around to really get all angles here. So now that we have done SMR, we're going to do some static stretching.
Static stretching is used to increase the extensibility of muscle and connective tissue, in turn improving range of motion. Static stretching is additionally used to improve the viscoelastic components of neuromyofascial tissue. It is thought that static stretching of 20 to 30 seconds causes an acute viscoelastic stress relaxation response, allowing for an immediate increase in range of motion. For our following video, static stretching technique will use a set count of 4, a duration of 30-second hold of the active stretch, and a frequency of daily.
Alright, so moving on to our static stretches, the first one that we're going to be doing is the supinated wrist extension. So what you're going to do is you're going to place your palm up, you're going to bend your hand, and you're really going to feel the stretch in the extensors there. Do you feel that?
Mm-hmm.
Perfect. So we're going to be holding this for 30 seconds.
Isolated strengthening is a technique used to increase intramuscular coordination of a specific muscle. These exercises are to be performed immediately after inhibitory and lengthening techniques. Isolated strengthening can be performed 3 to 5 days per week, depending on the intensity and volume used. For our following video, isolated strengthening technique will use a set count of 2 with a repetition count of 12. The duration of the movement will use a 2-second isometric hold at the end range and a 4-second eccentric contraction. We will be doing these exercises 4 times per week.
Alright, so for the third phase of the continuum, we're going to be doing activation.
The first exercise we're going to do is a dumbbell wrist curl. So I'm going to demonstrate to you first, Melissa. You're going to come have a seat in the chair. You're going to extend your arm past the table so that your wrist is hanging off the edge. You're going to have the dumbbell in hand, and you're just going to curl towards you. Okay. Really initiating this from the wrist and no other joint within the arm. And you're going to be doing this 2 sets per side, 12 reps.
Alrighty.
All right, we'll get you to try. Yep, so right over the edge. You want to initiate right from the wrist, nothing from the elbow or the shoulder. How's that feel?
Good.
Yeah, good, and coming down into full extension. We're really working the flexor muscles here after we've just inhibited the extensor muscles. After the appropriate muscles have been activated, the final component of the CES continuum can be employed, utilizing integrated dynamic movements. Integrated dynamic movements involve the use of total body exercises. Essentially, integrating dynamic movements enhances the functional capacity of the human movement system by increasing multiplanar neuromuscular control. For our video, the integrated strengthening technique will use a set count of 2 with a repetition count of 14. The duration of the movement should be slow and controlled with a frequency of 4 times per week. All right, Melissa, so for our first integrate exercise, we're going to do a squat into radial deviation. So what I want you to do is step onto the resistance band, shoulder width apart. Okay? We're to engage the core, and your palms are going to start facing each other. Okay? You're going to come down into a squat position, and at the top, you're going to flex your wrists upward. Okay? Making sure that those palms are still facing each other. And flex. All right, we'll get you to try. Step onto that band, shoulder width apart. Engage the core, and then I want you to keep your chest up and out. Radiate, nice. Perfect. You want to make sure that these movements are slow and controlled. Awesome. So we're going to do 2 sets, 14 reps, all right?
All right.
Last one. Perfect. Neuromuscular stretching combines the benefits of both static and active stretching while keeping the risk of tissue injury low. Neuromuscular stretching is effective by taking the muscle to its end range of motion, integrating an active contraction of the muscle to be stretched. The client will passively or actively take their muscle to the new end range of motion and statically hold this new position for 20 to 30 seconds. For our neuromuscular stretching technique, we are utilizing a set count of 4 with a duration of 30-second hold. The frequency of our neuromuscular stretch will be daily.
So for the second static stretch, we're going to be doing neuromuscular. So we're going to have the exact same thing. So we're going to have supinated wrist extension. But what you're going to do is you're going, Fallon, I'm going to get you to push against me for 15 seconds. And then I'm going to press against you to get you a little bit more of a stretch there in the extensor. So ready? So press against me. Job. And release. You really want to make sure that this arm is straight so she really gets the stretch there. And then press again. And release. Alright, so with the neuromuscular stretches, we're going to do them 4 times. The first time the resistance is going to be about 25%. The next time will be 50, the third time will be 75, and the fourth time will be 100.
Okay, so our second activate exercise is called a tennis ball squeeze. So what we're going to take is this tennis ball right here, Melissa. We're going to get you to just place out in front of you, extend a little bit. What we want you to do is to squeeze the tennis ball. You're going to hold a 2-second isometric contraction and slowly release for a 4-second count.
Okay.
And we'll get you to squeeze again, hold for 2, 4-second count, release. So again, we're going to get you to do this 2 times on each side at 12 repetitions.
All right.
Just do a couple more together. 2-second isometric hold, 4-second release. Really working those flexor muscles. And then we switch sides. Perfect. Alright, Melissa, so for our second integrate exercise, we have a dumbbell pronation and supination into shoulder press. So I'm going to show you what that looks like. I want you to put your feet shoulder width apart, slight bend in the legs, and I want you to work to engage your core. Alright, you're going to have your palms facing each other to start. You're going to supinate, come up into a bicep curl, pronate, and press overhead. And you're going to come back down, palms facing each other, supinate, bicep curl, pronate, and press overhead. All right?
Sounds good.
Get you to try. Again, I want you to work into a slow and controlled movement. Feet shoulder width apart. Okay. Engage that core, slight bend in the knees. Perfect. We're going to get you to supinate, bicep curl. We're going to pronate and press overhead. Perfect. Come back down. We're going to do a couple more together. So we're going to do 2 sets at 14 reps. Nice, slow and controlled movements. Breaths. Come back down. We'll do one more. Palms facing. We're going to supinate, bicep curl, pronate, and press overhead. Very nice.
Is a pronation wrist extension. So we're going to be flipping the hand around now. So you want the palm to be facing towards you, and you're going to put the other hand on the other side of your wrist here, and you're just going to press down. So you're going to be feeling the stretch in the top part of your arm here. Do you feel that? Mm-hmm. Good. So again, holding for 30 seconds.
Activate exercise we have is a resisted band wrist flexion. So Melissa, what you're going to do is you're going to take a resistance band. You're going to step on it about a quarter of the way down just to add some resistance, and we're going to get you to rest on your leg. So it's going to be the same kind of motion that we used with the dumbbell. You're just going to flex at the wrist and then fully extend. And then flex. So the resistance is going to be really dependent on how far down you step on the band. Okay. All right, so we'll get you to have a seat. All right, so we'll get you resisting.
All right.
Yeah, and still maintaining that posture when you're sitting. So really work to engage the core. And again, we're going to do this 2 sets per side at 12 reps. Do a couple more sets with you here. Always maintaining proper posture through the kinetic chain. And relax. Alright, so for our last integrated exercise, what we're going to do is do with the resistance band. We're going to get you again to step on the band, shoulder width apart. We're going to work into a bicep curl, but before we come up into that motion, I want you to flex up the wrist, come up into a bicep curl. All right, and then back down. So flex, bicep curl. Again, take a slight bend in the knees and work to activate that core. Nice. All right. So flex at the wrist and up into a bicep curl, and then back down. Again, we're going to do 2 sets at 14 reps. Nice, slow and controlled movements. Perfect, and then do one more for you. Flex at the wrist and up into a bicep.